With more than a decade of experience in facial rejuvenation and hair restoration, Dr. Scott Thompson is helping so many people here in Utah. Utah Facial Plastics is in Layton and Draper, and we are talking today about regenerative medicine.
Right.
Thank you for coming in.
Thank you for having me.
This is exciting, and I think it's exciting because we've come so far.
We really have. Things have changed dramatically from, several decades ago, even 1 decade ago. We have so many more options that we didn't have before.
Yeah, absolutely. Okay, so what is regenerative medicine?
Regenerative medicine is just a term that refers to us using our own tissues, our own cells to help heal areas of the body or regenerate areas of the body. And specifically where I'm talking about is in facial cosmetic areas, but it's used really in bone regrowth and arthritis, all sorts of different areas in medicine. And it's using our own cells, our own platelet-rich plasma, and sometimes stem cells to accomplish that.
Yeah, we became familiar with the PRP,
yeah,
which I think
PRP
is what it's called.
Yeah,
is what it's known as. We became familiar with that last year when I did that vampire facial, and I was just amazed at the results. So how does it actually work?
So PRP, the platelets that we all have in our bodies have all of these growth factors that help to stimulate growth of new cells. They help to get rid of old damaged cells. And so if you put those concentrated cells into an area, then they have kind of a hyperstimulatory effect in those areas. And so they can take away fine lines, they can help grow hair. There's all kinds of different options that we have for the face.
Yeah, okay, so here are some of the vials. So we showed the vials, and so what you do is you take a little bit of blood.
Right, just draw a little bit of blood, spin it down, separate the red blood cells from the serum and the platelets, and then we just draw it up and use it wherever we want.
All right, so you talked about how it works for skin rejuvenation, and we're seeing some before and after pictures, and these are incredible. But I did not know that this works for hair loss too.
Yeah, in fact, there was just there's actually been quite a bit of study in this, but in the April Dermatologic Surgery Journal, they did a randomized placebo-controlled trial, which is the best kind of trial you can do, and they showed significant differences. Basically, they treated one half of the head and didn't treat the other half. That's the best way to do a study. And they showed significant improvement for all the patients. Now, I'm always quick to point out, it doesn't grow hair from somebody. That's exactly right. But it'll increase the density, the thickness, and the quality of the hair.
So who would be a good candidate? Is this men who are just starting to see some balding?
It's good candidate. It's a good option for women that are noticing that they're losing a lot of hair. That's probably the most common people that I use it for, because a lot of times they're not necessarily the best candidates for hair transplant. It's also a great option for people that have had a hair transplant and we're just trying to enhance the results
Picking it up
a little
bit.
Exactly.
All right, and so, but this is not something that's just like you rub on. You come in for the procedure.
That's correct. You have to actually get it underneath the skin, so we inject it with either microneedling on the face that we talked about, or sometimes for the hair we actually inject it with a little bigger needle like a Botox needle.
Right, okay, which is painless pretty much.
Very
it's like a 1
pain,
to 2.
It's a little bit of a poke,
Right. And how many treatments do you do, and then does it last?
So typically you do 1 to 2 treatments in the first 1 to 2 months, and then we kind of reassess at about 6 months. And most of the studies have only followed this out for 6 months. And so honestly, it's fairly new. We don't know, if there are effects that are 10 years or 12 years. I don't think so. I think it's something that will have to be repeated periodically.
Right, but it's exciting.
It's very exciting.
It's a fun new option.
There's just so much research that's happening that is just kind of changing the field of medicine in general, and specifically what I do.
Yeah, I know. It is exciting. I like that. Okay, so there is a special. It is $300 off 2 PRP hair or skin therapy treatments. Okay, and you can go to the website, utahfacialplastics.com. Thank you so much. Bet your patients are loving it.
Thank you for having me. I appreciate it.
Well,